I think some of the biggest pieces right now is really looking at people's kind of choose your own adventure in terms of sexuality. So watching people get to figure out what it is that makes them tick, the big push to be able to explore toys, the less reliance on labels in terms of sex and sexuality and gender, really truly watching clients get to be themselves in whatever that definition is and whatever that looks like for them.
Hello, everyone. I'm here today with Amanda Jepson. She's a SHA certified and AASECT-certified sex therapist and trauma specialist who empowers survivors to reclaim their sexual selves while training the next generation of therapists to provide affirming care for erotic minorities. Welcome, Amanda.
Thank you for having me.
Thanks so much for being with us today. I want to start out by asking you, what does the term erotic minority mean to you? And what are the most important concepts you want future therapists to understand?
Yeah, so when we're talking about erotic minorities, essentially what we're talking about is anybody that is outside of the normative identities. So this is going to encompass queer folks, trans folks, disabled folks. This is also going to include people of color, kinky folks, people that are outside of like straight sizing, so larger bodies as well. It's just our way of trying to think about people who we oftentimes don't automatically consider when we're thinking about sex or sexuality. And I think some of the biggest things when we're talking about what I'm wanting other clinicians to consider is making sure that the way that we are conceptualizing clients when we're looking at what interventions we want to use, that we are considering how those might impact people that are outside of the societally kind of determined identities, because oftentimes when we're looking at some of those interventions, we're seeing impacts that are different than intended because were not normed on or weren't considering erotic minorities when they're developed.
All right, now I want to talk a little bit about you. So, what is your 30-second origin story? How did you find your way into sex therapy? And when did you realize this is my specialty?
So I was a trauma therapist right from the very start. So I started off working in a rape and sexual abuse center. However, what I was finding was when I was working with my trauma survivors, they were mostly recovered, but they were still struggling in terms of pleasure, like just in general, not even just sexual. They were struggling in terms of relationships. They were struggling in terms of giving themselves permission to reconnect with themselves or with other people. And that is when I stumbled across notes from earlier on in my career about sex therapy. And I rediscovered sex therapy as a concept on like a Monday or Tuesday, emailed SHA, and by that Friday was in Dallas for a training. So it worked pretty quickly. And so it really was the missing piece for my clients. It was being able to find sex therapy because it really was kind of after most of the trauma work was done, when clients were in that stage 3 of trauma work, that's right kind of when the bulk of therapy begins. It's always been my specialty. I actually ended up at that rape and sexual abuse center kind of by accident because I was trying to work with LGBTQIA folks. And so place that I started off at, that I did my internship at, 75% of their caseload was LGBTQIA. And that's how I ended up there. Just so happened to be trauma. So I always joke that I worked with queer folks on purpose and trauma almost by accident. But trauma really is my home. It's where I like to do my work. So now I work with military. So I work with active duty, veteran military, and first responders. So I'm still doing heavy trauma work. But beyond that, I work with queer folks, trans folks, non-monogamous folks, kinky folks, or people that just want to be able to be comfortable in their sexuality without being judged by their clinician. And so that's kind of how I knew that I was in my specialty, was when clients were feeling safe with me and we were doing really good work, whether that was trauma work or reclamation of pleasure.
All right, now what's one current shift or trend in sexual health that genuinely excites you right now?
I think some of the biggest pieces right now is really looking at people's kind of choose your own adventure in terms of sexuality. So watching people get to figure out what it is that makes them tick, the big push to be able to explore toys, the less reliance on labels in terms of sex and sexuality and gender, really truly watching clients get to be themselves in whatever that definition is and whatever that looks like for them.
All right, now if you could teach the world one essential insight about sexual health, something that really moves the needle, what would that be?
I think it's really blending in the trauma-informed pieces. A lot of times when I'm in therapy circles, there is this idea that therapy looks a certain way and should move at a certain pace. And what I've really loved doing is blending in that trauma-informed piece. It really slows things down a lot. It really makes it much more accessible for most folks. And what I really see is the best practice that it creates has better outcomes for all clients, even those that haven't experienced trauma. And it really kind of dispels this idea that there is one size fits all in terms of the order of things or how fast things should go. And it really helps clients set their own pace and really helps clinicians really see where their clients are. So for example, when clients are doing sensate focus, which is kind of that multi-layered, multi-staged touch exercises, it really lets clients kind of sit at the stage that they're at. Sometimes we will do a stage 0 clothing on or setting the stage, let clients stay at that stage 1 until they really feel ready to move on to stage 2 instead of the much faster pace that most therapists do.
All right, now, as you know, at Sexual Health Alliance, we train many people who want to work in sexual health. So, what's the most important thing professionals in this space need to know?
I think it really is identifying our own bias and our own hurty bits in terms of sex and sexuality. The amount of times that I hear clinicians that are just starting in sex therapy or are generalists making conclusions about what's healthy and what's not based on their own opinions or their own experiences. It's mind blowing, quite frankly, how many times people have not sat with their own messaging, their own experiences, their own beliefs. And that goes anywhere from people who are maybe not positive all the way to people who, like, for example, put up on a pedestal, right? We
Yeah.
want to make sure that we're not over pathologizing the behaviors or over romanticizing them as well. So really making sure that we're walking kind of that middle path somewhat of destigmatizing things for ourselves so that we can properly destigmatize it for our clients as well.
And now, in the same line of questioning about training, where do you see the biggest gaps in traditional clinical training around sexuality?
I think some of the biggest gaps that I really see in terms of talking about healthy sexuality and some of the issues related to out of control sexual behavior or problematic sexual behavior, I still see a lot of language that equates it with addiction. I still see a lot of language that equates it to this really standardized idea and somebody external to the person deciding what is and isn't healthy. That isn't to say that sexuality can't be unhealthy. Sometimes it is expressed in ways that are harmful or hurtful. It can be expressed in ways that causes distress for the individual. But what I am seeing is a lot of external judgment on how we measure that, even with some of the diagnoses in the DSM, where it is the clinician is making the determination whether or not the desire is sub-threshold for the individual, or the clinician is making the determination whether or not this is problematic, and we're not listening to the clients and where they're at. So I think some of the biggest gaps there are how do we treat individuals that are engaging in behaviors that cause them distress and helping them really understand it holistically. So we're treating the whole person, not just that surface level behavior. And then I also think that it is in terms of helping clinicians, again, kind of unpack their own biases, their own ideas of what is and isn't healthy so that we can listen to the clients and where they're coming from.
Become an in-demand sexual health professional. Gain expert education and become a SHA certified therapist, coach, counselor, or educator. Hit the subscribe button to learn more.
And I'm wondering if you can give me like a case study example. Like, what does really good care for erotic minorities actually look like in practice?
When we're talking about erotic minorities, I'll give you a good case example. So we'll say 36-year-old Indian male, cis male, queer, in a relationship with his partner for 3 years. His partner is female, but he himself is queer, which is really important to this story. So this client in particular came into therapy because he was consuming incest porn and it was causing him some distress. There were also queer elements in the incest porn that he was consuming as well. Family of origin was a bit chaotic. Each of the children, oldest sister was parentified. This client was the middle child, and he was the peacekeeper. He was the one that was supposed to make sure that everybody got along. And then his youngest brother was, in his words, screw up, we might say. Lots of inner turmoil between the children, trying to make sure that they were all taken care of. Parents had some addiction issues and some instability issues. I give that background just because there's some trauma elements in here. Client was mortified about what could happen if his girlfriend found out about the porn he was consuming. And what he would do was engage in sexual behavior, consume pornography, afterwards feel immense amounts of guilt and shame, which then would impact how he showed up with his partner. And she was very concerned because she could tell that something was going on. In a client like this, for a client like this, there's a couple different things that we want to do. The first is normalize the behavior. Client in this case was actually purchasing porn from ethical sites, which is usually something that we actually have to educate clients about. But he was already doing that. So we talked about ethical porn sourcing and made sure to give him credit for the fact that he was actually consuming it from an ethical source. We did also talk about the research. I actually pulled in Tell Me What You Want from Justin Lehmeller and talked about how taboo porn is one of the top fantasies. And so normalized it for this client. Normalizing it did help him reduce guilt and shame quite a bit here, but he still wanted to reduce his consumption of it. So it did help him have less beating himself up afterwards. However, we still looked at varying the types of explicit material that he consumed. So he did use some mental imagery. He did do some dirty texting with his girlfriend. He also started doing things like reading erotic novels. And so we tried to change it up for him so that he wasn't only relying on a single way of getting himself aroused. What we found with this was he was actually able to increase the type and variety of porn he was consuming, the type and variety of explicit material. He also found that using his internal mental imagery made it so that a lot of what he was thinking about was much more in alignment with his overall sexuality. So what we found is it actually increased his comfort with his queerness. And he also got to share some of those themes with his girlfriend, and she was really accepting. And so what we found was the individual was able to achieve his goal of consuming less of the porn that was causing him upset, but he also reported better acceptance of himself. He also reported that his girlfriend was much more accepting of his erotic template than he initially thought she was going to be. So positive outcomes for client all around, a lot less anxiety, a lot less guilt and shame, and a lot more self-acceptance and increased report of relationship satisfaction. And I think it brings in a little bit of what I was talking about in terms of problematic sexual behavior, right? So when somebody comes in saying they want to do less of something because it's causing them distress, it's a good example of being educated in how to handle problematic or out of control behavior, because a lot of clinicians will rush to reassure the client or try to dissuade them instead of normalizing it and still letting the client kind of choose their own adventure.
All right. Now, if you could leave one message for the next generation, so let's talk to our Gen Zs and our Alphas. If you could leave them one message about sexual health, what would it be and why does it matter right now?
I think the biggest thing is embracing analog sexuality as well. There's such great normalization of digisexuality, and I think that it is absolutely wonderful and fantastic. I want to make sure that we are also doing some of the analog stuff too. And I think that it matters because it really is helping us approach the whole client. Right. I want to help people find the digital fun, but I also want to help them find the in-person or the IRL fun as well.
You are a SHA alumni and you've presented with SHA before. So I'd love to hear, what was your experience like as a SHA student and as a presenter with us?
So I have a really interesting SHA experience. I started off in 2019, so before COVID. So I got to go to the trainings when they were still all over the country. So like I said, I started off going to my first weekend in Dallas. I got to go to some trainings in Austin. I then got to do most of my asynchronous learning during lockdown. So I kind of got both worlds in a lot of ways. And so I absolutely loved the people that I met in SHA. Some of the most important people in my life are people that I met in all of those trainings. Still travel together, we hang out together, we message every day. They are some of my favorite people. And I am forever grateful for SHA for introducing me to people who think similarly. It has really been eye-opening. And I think that just being able to have the community has been probably the most important part. I also have a lot of appreciation for the topics that SHA teaches. I think the problematic sexual behavior certification was one of the best things I have ever taken.
What was your experience as a presenter like?
I really love presenting with SHA. And so I think two in particular stand out. And so the weekend, the exceptional weekend with Midori, that one was so incredible. There were such great questions that came from that one. I got emails from students afterwards that were really curious. Absolutely fantastic questions. And then I think this last was really fantastic too, the in-person one. I really enjoyed getting to talk about compersion, the energy in the room. Usually I prefer in-person trainings just because there is some magic that happens when you have everybody in the same room. And there were people being vulnerable and open and honest about their own experiences. It almost made me tear up because there was just such beautiful sharing happening. But I think that regardless of whether it is online or in person, SHA folks are curious. They ask great questions. They are not afraid of doing the work for themselves. And I think that's probably been one of the biggest takeaways that I've had.
Community is genuinely the best people, so inclusive and welcoming and so curious all the time. I just love our community. All right. Well, thank you so much for being with us today, Amanda. It was a pleasure.
Thank you so much.
All right. Bye, everyone.